Hello, I'd like to talk about liposuction of the neck today. And I would say it's one of the most frequent procedures that I perform. People want to have this area called the mentum, submental and submandibular areas. And what happens is that the fat is removed and the skin, as long as it has good elasticity, it will contract and snap back. So this procedure can be done under local anesthesia in my office. The patients are usually given something to kind of relax them a little bit. They could talk to me, listen to the music, talk to the nurse, and they lie down. And what happens is a couple of little openings are made, little incisions are made. And then what's called wetting solution is put in there, and that contains numbing medicine or lidocaine, adrenaline, and some saline or salt water. And we wait a little bit. Once that's set up, it makes the tissue firm, and I'm able then to use something like this. These are these blunt cannula that go in through the openings and they remove the fat. And it's kind of interesting. It sort of honeycombs, if you were to look inside there, it kind of honeycombs the tissue, and the blunt instrument would rather pass by the little blood vessels and nerves and protect the skin because it's blunt and just extract the fat. From that point on, it's up to the skin to contract. And basically, this is living tissue. It's not a rock or a piece of wood. It doesn't like to be burned or lasered. It just gently likes the fat to be removed without traumatizing or piercing these blood vessels, nerves, and other structures. So the goal is to remove this extra fat. And today, with all these selfies and photos we take every day, we look at them and people often see this fat here and it distracts from the beauty and from the photo. So this is commonly done. The recovery for this is quite simple. There's a chin strap that has to be put on, and it looks something like this, just this band. You don't have to wear the headband, just this part of it. And what that does is it gently compresses the skin against the underlying muscular tissue. And that sort of seals the tissue there for 5 days. And at that point, the patients are, free to go back to work easily. They could show up in public without many people noticing. The final results you probably see within 3 to 4 weeks is looking really, really good. But even at 5 days, you'll be shocked how good people look. And there's a very high patient satisfaction with this. So I would say if you'd like to learn a little bit more about this and explore this, I'd like you to contact me, and I'll see if I can help you too. Thank you.